Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine Podcast. I'm your host, Yaron Ivan, as usual. And today we're going back to talking about our rules. We're going to talk about some rules in the clinical care category, with the exception of the first rule, which I really did not categorize because it's that different and that important. The two other rules we'll speak about are really clinical care tips, but we will start with rule number 64. And rule number 64 says, the most important things in life are usually not found in the pediatric emergency department. So again, this is not a clinical care tip. This is just something that I feel is important to keep in mind. And this is something that I think, unfortunately, some doctors have learned the hard way. So I'm a pediatric emergency doctor, and my career was very demanding, a lot of schooling, a lot of homework, a lot of studying, a lot of USMLEs. And very often it requires a lot of time away from the family, away from the kids, away from the wife. But I think it's important while you go through it to keep in mind that the most important things in life are usually not found in the pediatric emergency department. In other words, medical students, residents, fellows out there, please be aware and remember, as a person, as a father, as a husband, your primary commitment is always to your family, to your friends, to the people around you. Career is a very important thing, and it's something that we definitely invest in. However, it's important to remember that the people that surround us and support us are probably a lot more important. So again, this is not a clinical care tip per se, in fact, probably not at all, but it's important that we all keep in mind. Family comes first. I'm guessing many of you have heard the phrase, nobody says, I wish I spent more time in the office on their deathbed. And that's probably very true. When you look back at your life, you look back at your experiences with your family, with your friends, with your spouse, with the people who are important for you. Career only goes so far. Now, it's very hard to keep that rule in mind when you go through training, investing so much time and money in your career and your training. It's very easy to forget the things that are important. My advice to you trainees out there, invest time in your career, invest the money in your career, but keep in mind, family, friends, the people who are close to you always come first. So make sure you prioritize correctly and make sure you do not neglect the people around you who are probably big supporters and are probably a big reason you are able to go through your studies and your training despite all the challenges and the hardships. So keep that rule in mind. The most important things in life are not found in the pediatric emergency department. In fact, they're probably not found in any workplace. Rule number 65. Kids who do badly tend to do badly again and again and again. This is a rule that I keep in mind when I take the HPI or the past medical history from a parent or a patient. So again, example. One of the ways I obtain medical history from the patients or from the parents is really by asking a set of questions that are not necessarily in the order I learned in medical school. So the way I usually do it is as follows. I introduce myself, I speak to the mom or the dad, and I ask, Mom and Dad, does your son, your daughter have any medical problems? Do they take any medications on a regular basis? Have they ever been to the hospital for anything serious or surgical? And this, I think, is the question that I find to be very important. So let's say the parents say, oh yeah, doctor, our son has been to the hospital 4 times for pneumonia in the past. Well, if little Johnny's chief complaint today is cough, fever, and he's had pneumonia 4 times in the past, that is definitely something I want to know about. Because kids who do badly tend to do badly again and again and again. And if that patient had pneumonia 4 times and today's chief complaint is in any way related to the respiratory system, I personally should be very, very worried about pneumonia and have a very low threshold to obtain a chest x-ray. Easy, simple. Another way I think that rule comes to mind is when thinking about medical history. So we all know that one of the biggest risk factors for pancreatitis is history of pancreatitis. One of the biggest risk factors for suicide is prior history of a suicide attempt. So kids who do badly tend to do badly again and again. And listening to that part of the history is very important so you can investigate and work up the patient appropriately. Another thing that stems from that rule is the way I obtain medical history from asthmatics. When I see a patient in the pediatric emergency department with a history of asthma, I take the minute to ask them the four questions. So I ask the parent, Mom and Dad, has your daughter ever been to the emergency room for asthma? And if they say yes, I move on. Has your daughter ever been admitted, stayed in the hospital for the asthma? And if they say yes, I move on. Mom and Dad, did your daughter actually have to stay in the pediatric ICU for asthma? If they say yes, now I'm very worried by the way, I ask them the last fourth question. Do you happen to know if your child ever been intubated for asthma? A patient that said yes to all of those four questions has a very uncontrolled or poorly controlled asthma. That's a child I'll be very worried about, treat more aggressively, and have a very low threshold to keep in the hospital. Because kids who do badly tend to do badly again and again and again. And this child who answered yes to all four questions, and even if they answered yes to just two or three, has what I would consider a poorly controlled asthma and tends to do badly again and again. So that is very important for me to know when I obtain medical history. And if this child is well appearing now, I may observe them in the emergency department for longer just because of their history. I may decide to keep them for observation just because of that history, because rule number 65 says kids who do badly tend to do badly again and again and again. So keep that rule in mind when you obtain a medical history and you decide about your disposition, your workup, or your treatments. Rule number 66. Be the definitive care when you can. So what does that rule really mean? To me, it means that there's a subset of patients where I can be the definitive care, I can take care of the problem, possibly resolve it, and send them home. If that is within my capabilities, that's what I'm going to strive to do. Unfortunately, when I diagnose appendicitis, I cannot be the definitive care. When I diagnose any surgical problem, I cannot be the definitive care since I'm not a surgeon. However, anything that is within my scope of practice, I'm going to try to apply so I can send the child home safely. A good example for that is a laceration, even when it involves the face. I think it's important for us emergency physicians to keep in mind that, for the most part, most lacerations are within our scope of practice. So, when possible, even if I need to do sedation for it, I'm going to sedate the child, suture the child so I can send him home. I usually take the minute or two to explain to the parents that as a physician, emergency physician, pediatric emergency physician, I'm very comfortable suturing laceration. I'm going to tell them what to do to minimize the scarring, and there's really no reason not to take care of this today. Obviously, if the parents ask for a plastic surgeon, I don't deny that, and I always try to accommodate their requests. But I make it clear that this is within my scope of practice and I can do this. Another good example for this rule is most fractures in children. So, as we know, most fractures in children do not necessarily need reduction or sedation. And many times, splint and send is a very reasonable approach. For example, buckle fracture, Salter-Harris 1 fractures, and even Salter-Harris 2 that are mildly displaced. When possible, I try not to involve the orthopedics. They are very busy and have very big things to worry about. Any child that has a non-displaced fracture, a buckle fracture, or a Salter-Harris 1 fracture, I splint myself so I can send them home to follow up with someone else some other day. I see no reason to involve the orthopedist today, which may prolong the time in the emergency department, possibly involve more x-rays or more unnecessary follow-ups. When possible, I try to be the definitive care for a child as long as it is in my scope of practice. Now, in order to apply this rule, you really have to be very experienced and seek the opportunities to get more practical experience with procedures and expand your knowledge to the best you can. I think it's very easy to have a low threshold to consult people, but this way, unfortunately, it's harder to learn. So those of you out there who are still within your training, see a lot of patients. Seek the opportunities to learn so you feel comfortable with procedures, with sedation, so you can be the definitive care for many kids out there, and this way not have a low threshold to consult, delay care, and prolong the ER stay. So whenever you can be the definitive care for a child and send them home, do exactly that. And that is it for today, guys. Thanks again for listening. Let's review what we learned. Rule number 64. The most important things in life are usually not found in the pediatric emergency department. Trainees out there, Remember, your family, your friends, the people around you always come first. Rule number 65, kids who do badly tend to do badly again and again. Keep that in mind when obtaining the history, doing your workup, and deciding on your disposition. Rule number 66, be the definitive care when you can. If possible, do the sedation, do the reduction, send the child home. If this is something that is within your scope of practice, suture that laceration and send the child home. Have a higher threshold to consult so you can be the definitive care for those children, send them home, and have them follow up on an outpatient basis. I hope you enjoyed the episode. I hope you tune in next time. Feel free to leave some feedback at www.pemrules.com. I'd love to hear from you guys. Have a great day.